Here are some supplements that you might actually need whilst on a GLP-1 as someone with PCOS, because the internet makes it sound like you need a whole suitcase of them. Not everyone needs supplements on GLP-1s, but some people do, and it depends entirely on how your appetite, digestion, and overall intake changes. Here are the main ones to know. First, a general multivitamin. GLP-1s reduce appetite, which means some people accidentally undereat. A multivitamin helps cover the basics if you're eating smaller portions or fewer meals. Second, vitamin D. Loads of people with PCOS are deficient anyway, and lower intake while on GLP-1s can make that worse. If your levels are low, supplementing helps with metabolic and immune health. Third, B12. This one matters especially if you're also on metformin. Metformin can reduce vitamin B12 absorption, and pairing it with reduced appetite can increase the risk of deficiency. Fourth, omega-3, which is helpful for inflammation, triglycerides, and overall metabolic health, particularly if your appetite for oily fish drops. And then protein isn't a supplement, but it does need attention. Rapid appetite reduction means that many people accidentally eat too little protein, which increases the risk of losing muscle. A protein powder can be useful if eating enough protein through food becomes difficult. But here's the most important thing. You need a doctor or dietitian checking your bloods, your intake, and your symptoms before throwing money at pills. GLP-1s can be incredibly effective, but only when you're nourished, supported, and monitored properly.